Hi, welcome and good afternoon. This is Elizabeth Hardig with the American Planning Association. We are excited to have you here this afternoon for a special co-hosted webinar between APA's Planning and Community Health Center and the National Physical Activity Society. It is just about 3 o'clock and I see folks are still entering the webinar room. So I do want to give you a chance to respond to the poll if you haven't already. We're so excited to have both organizations represented on the line here with our panel. We wanted to see who is in the room with us. So if you're a physical activity practitioner, please select from a couple of options. If you're a planner, please choose from a couple of options. Or if you're a public health professional, or if you're all of the above, please let us know who's with us this afternoon. So before I close the poll and share the results, I did want to touch on a couple of housekeeping items. We are recording the webinar. This session will be sent out via email after the webinar today and will be available on the Plan for Health website. We do have a copy of the presentation in the handout box. You're welcome to download a PDF of the slides you'll see this afternoon. And we are saving our discussion for the end of the hour, but feel free to chat any questions in the question or chat box that you should see on the right-hand side of your screen. All right, with that, I will officially close the poll here and publish the results. So you should be able to see, I hope, that we've got quite a few planners in the room, which is always great. We do have a few physical activity practitioners, which is wonderful, and some public health professionals, which again is fabulous to have cross-sector work represented in the room this afternoon. All right, and I'm going to go ahead and share our presentation and start to kick things off. So as I mentioned, this is a special webinar between the American Planning Association and the National Physical Activity Society. And we wanted to really take a moment and share a bit more about the two organizations before diving into our presentation from Idaho this afternoon. So to kick things off, I'm going to turn things over to Kayleen Coates. So Kayleen is a principal planner for the City of Newark's Department of Water and Sewer, and a co-chair for the Healthy Communities Collaborative, an interest group at APA. Kayleen is currently leading communications and public engagement activities for the City of Newark. And in a prior role, Kayleen led research and planning projects on transportation and community health. She was also the project manager for Plan for Health Initiative in Trenton, New Jersey, where she collaborated with city planners and project stakeholders to develop New Jersey's first health and wellness master plan element, which has been a fabulous success from Plan for Health. Kayleen holds a master's degree in city and regional planning from Rutgers University and a bachelor's degree in urban studies and public policy from CUNY Hunter. So we are excited to have Kayleen with us this afternoon to talk a little bit more about the Healthy Communities Collaborative at APA. And with that, Kayleen, I'm going to hand control over to you.
Great, thank you so much, Elizabeth. Hi everyone, I'm Kayleen. I'm so excited to share information about the Healthy Communities Collaborative, an interest group of the American Planning Association. I am the co-chair of the collaborative, and I think Elizabeth gave enough of an introduction for my bio. I will say that the Plan for Health project connected me to the Planning Community Health Center and led to my involvement in this collaborative. And as the co-chair of the collaborative, I've been working with the other co-chair, Grace Kwong, and APA staff from the Planning and Community Health Center to further develop and organize the interest group. Next slide. Next slide. So I'm going to read you our mission statement so that you really get an understanding of the purpose of this collaborative and where we see the group going. The Healthy Communities Collaborative is an American Planning Association interest group of planners and allied professionals who are interested in fostering cross-sector collaboration and increasing capacity to support building healthy communities through the local, regional, state, or national level. So as an interest group, you do not have to be an APA member to participate, and we actually encourage outside profession to join our collaborative because in the end, this really enhances our goal as cross-sectoral collaboration. Next. So I joined the collaborative because I was interested in further building upon the Healthy Communities movement that for me was catalyzed in grad school and by the Plan for Health project. And for others, there's many other supporting factors. I joined because I was interested in connecting with other folks across the nation that are working on the promotion of healthy communities, because I was interested in sharing and learning about projects, partnerships, and ideas for supporting healthy communities to leverage in the work, hopefully, that we're all doing in our own jobs, in our own communities. Next. The collaborative has regularly scheduled quarterly calls to share and learn with group members. We have 3 working groups, which include policy, education, and then the partnership/outreach working group. And each working group talks bi-monthly, and they're each working to develop action items for promoting healthy communities. And this has been really important in the group. We didn't want it to just be a group where we talk about what we want to do. We want to build contributions that collaborative members and beyond can use. We are fortunate to have reps from APA's Planning Community Health Center involved in our structure and for each working group. Next. So far, each working group has had the opportunity to begin identifying potential initiatives and projects that they may want to undertake as a group in the future. Some of the ideas that the policy working group talked about included creating a resource to help planners understand where they can influence health in their work, identifying what zoning codes are doing to further the goals of healthy communities, promoting health in all policies to planners that are not already involved in the healthy communities movement, and providing review and critique of APA's healthy policy guide that's currently under development. There were others, but I only included kind of just an example. Next. Some of the ideas the education working group talked about included identifying programs at higher institutions that are connecting public health and the built environment, and looking beyond just planning schools, looking at engineering schools, identifying opportunities for the medical field to contribute to the promotion and creation of healthy communities, creating educational opportunities to help expand the movement and expand advocates, and identify ideas for making the intersection of health and planning attractive to funders. Some of the ideas the partnerships and outreach working group talked about included creating new advocates to help advance the promotion of healthy communities, especially in cases where you can't be the advocate because of your role. Sharing best practices and a vision for working together as a way to get folks motivated in their own communities. Getting to know new people and organizations, what they are doing, and look for partnership opportunities. And then identifying and maximizing our current assets. as a part of our quarterly calls, we've created a platform for members to share what they are doing, the challenges and opportunities for their work, and where they need assistance. We believe this is an important opportunity for collaborative members to work together and share ideas, and for APA's Planning and Community Health Center to listen and respond to professional needs with future webinars and other tools. So there are several upcoming opportunities to get involved with the collaborative. You can join our next quarterly call on May 16th. You can participate in the upcoming working group calls at the end of April. And you can connect with us at APA. We have several opportunities to connect at APA's National Planning Conference in New York City in May. And then at the National Planning Conference, we'll have a walking tour from Bryant Park to Union Square. We'll have a pavilion presentation. We'll have an informal coffee chat time to connect. And we'll also have a business meeting where our working groups will begin to prioritize the actions that were identified for next year. And we'll have a joint reception with the food interest group at the Porchlight Bar. Finally, the team at APA's Planning and Community Health Center is working to put together a Healthy Communities Conference Guide that will have all this information and conference sessions of interest to the promotion of healthy communities. And all of these details will be included in the conference guide, and if you are on our listserv, you will get this before the conference from me. For more information and to get involved, email me and I'll add you to our listserv. Thank you so much, and I hope to hear from you all soon.
Great, thank you so much, Kayleen. That was a wonderful introduction to all that's been happening with the Healthy Communities Collaborative at APA. And now we want to transition over to the National Physical Activity Society, so our other partner this afternoon. And we've invited Pam Eatson to share a little bit more about the society and what folks are up to and how to get involved with NPAS. So for those of you who don't know Pam, for the last 25 years, she has been translating individual health behavior to systems thinking. How can we make the healthy choice the easy choice, which is certainly the spirit of Plan for Health. Our physical and social worlds affect how we behave, whether it's the availability of safe pathways to walk to school or the influence of coworkers who commute by bike. Pam has been the State Health Promotion Director in Georgia. She's been a Tobacco Control Entry-Level Coalition Assistant in West Virginia and a super commuter to Washington, D.C. She spent 11 years with the Directors of Health Promotion and Education, where she directed staffing for the first 5 years of the National Physical Activity Society's history. Pam synthesizes members' expertise, partner programs, and needs assessments to produce resources and training opportunities that help people do their job. And we are so excited to have you with us this afternoon, Pam, to share a little bit more with our members about the National Physical Activity Society. And I'm actually going to go ahead and pass control over to you. And you can take it away.
Looks like I might have it. Thank you, Elizabeth. Okay, does this work? Yes. All right, greetings everybody. I'm happy to be here to talk about the National Physical Activity Society, and my purpose here today is just to give you a brief overview of who we are before the president of our organization, Chris Danley, gives a presentation on some of the things that he's been doing. I want to tell you today a little bit about our members, a few things about some of the offerings we have, and then some of the people that we work with in our partner organization. Now, when National Physical Activity Society formed about 10 or 12 years ago, it was originally from the state health departments and their physical activity practitioners who often fell into the chronic disease realm or sometimes health promotion or nutrition. And those folks had been learning primarily through a physical activity and public health course that was put on by the University of South Carolina. And they started talking in the early 2000s with each other about how to form an association together so that they could continue to share and learn from each other. And that was the basis and origins of where this organization came from. But what it's grown to now includes not only state health departments, but also local public health agencies, universities. Our third largest constituency is academics, K through 12 schools, other nonprofits, and then planners and transportation engineers. We have business, and we have consultants and entrepreneurs and other people who are members of the society now. I'm going to skip this one for just a minute by saying that the common thread that brings those folks together is that they're looking at the public health approaches to physical activity, by which I mean data-driven and population-based, or using cross-sectoral partnerships, looking at interventions and messaging with an emphasis on policy or how things affect the different populations in a community, and that the National Physical Activity Society's job is in voicing and connecting and representing the perspectives of those partners. So here's some of the answers when we ask people what kinds of activities do you do on a day-to-day basis, and you can see that a lot of what our folks are doing involves collaborating with other people to help build capacity so that their communities and statewide efforts can build healthy communities. National Physical Activity Society has monthly webinars. Some recent webinar topics have included health impact assessment, a falling prevention program to prevent falls among seniors. This month we had one on the development process for the 2018 Physical Activity Guidelines. And we also have had another one that references the bottom bullet on stories from small towns, which is one of our projects that looks at towns across the country that have fewer than 25,000 people and the changes that those towns have made that promote biking and walking. And the effort behind Stories from Small Towns is to demonstrate that changes promoting walking and biking, whether they are intended to be for health or for some other reason, are not confined to big cities. So we're trying to counter that misperception that only, that this kind of work only goes on in the big cities. So we had a webinar in January with 3 of those towns. One of them had 1,500 people. Second one was population of about 4,000, and the third one had about 15,000, and had people from each of those towns talking about the changes that they've made. All of our webinars are available on our website for free. We've now made them all public, and so they're available for anyone who wants to go and look at the recording. The second bullet there refers to our PAPHS credential. That's Physical Activity in Public Health Specialist. It was developed originally about 10 years ago and focuses on competencies that people who are in the profession need in order to be successful. That credential is now managed out of the American College of Sports Medicine, which also does credentialing for things like exercise trainers and such. And one other thing that we do every other year, this would be in even years in the springtime, is a biennial survey of people who work in physical activity approaches to public health or public health approaches to physical activity, finding out what some of their needs are. And that's a lot of the basis for where we then develop our monthly webinar series and some of the other offerings that we then work on. A few of our partners, we do have some funding from CDC, and we work with some other associations there in the middle. But I'll draw your attention to the top left corner. We're part of the National Physical Activity Plan Alliance. National Physical Activity Plan was updated almost a year ago with its second edition and outlines cross-sector strategies for working among the whole country in how to improve physical activity. In the bottom left, we have the National Coalition for Promoting Physical Activity, which is more of a policy discussion group and Washington, D.C. focused legislative group. At NPAS, we don't have a government relations arm, but we do sit on that coalition so that we can keep in touch with what's happening in Washington. And over on the right bottom corner, the Everybody Walk Coalition, which is managed out of America Walks. is the organization that puts on the National Walking Summit, and they're gearing up for the 3rd National Walking Summit in September in St. Paul, Minnesota. We are a co-sponsor for that event, and the registration opens next week on that event. So highlight for your attention the National Walking Summit coming up in St. Paul, Minnesota in September. So that's a little bit about us at National Physical Activity Society. On our website there at physicalactivitysociety.org, you can sign up for our newsletter or for membership. Very easy to do either one. And you just go to the homepage and there are instructions from there, or follow us primarily Facebook and Twitter. We don't do quite as much on LinkedIn, but we do have a page there as well. And I look forward to working more with the American Planning Association. And now I'll turn it back over to Elizabeth.
Great. Thank you so much, Pam, for that overview and list of wonderful resources. We are going to shift gears a bit and really transition to our key speaker this afternoon, Chris Danley. And Chris, of course, embodies exactly this intersection between APA and the National Physical Activity Society. Chris has 10 years of planning experience with an emphasis on active living, planning, and health integration. Throughout his career in both the public and private sectors, Chris has worked in 3 principal areas: planning, assessment, and training. In the planning arena, Chris has led numerous bicycle, pedestrian, and safe routes to school plans, and created a planning model called the Activity Connection Plan, which has been implemented in dozens of communities. He's an expert in assessment with experience conducting over a dozen health impact assessments. And Chris has also conducted Complete Streets policy assessments and an approach called Healthy Conditions Assessment that aims to focus community resources based on demonstrated health indicators. And Chris is also, as Pam mentioned, is the president of the National Physical Activity Society, which is fabulous. So I'm actually going to turn things over to you, Chris, to tell us a little bit more about the work that you've been doing in Idaho.
Great, thank you very much, Elizabeth. I look forward to this. This is a wonderful opportunity. I'm not seeing quite yet the baton. Let's see. There we go. Okay. Okay, well, thank you, everybody. Good afternoon, and I appreciate you taking some time out to learn about what's going on in our little world up here in Idaho. I thank you to the APA. I'm excited about the opportunity for the National Physical Activity Society to have an opportunity to just kind of experience and show to everybody out there who and what we are about, and then certainly the opportunity to tell you a little bit about this project that's happening in my neck of the woods in Nampa, Idaho. And last, certainly but not least, I want to just make sure to thank the Blue Cross Foundation for funding this effort, and the city of Nampa itself for really allowing themselves to be opened up as part of this project. It's a pretty intense one, and I will say from the get-go that this project, it's actually about 13 years of experience, is the most rewarding project that I've ever been a part of. So it's one that I'm really, really excited about. Nampa, Idaho, just outside of Boise, maybe 15 miles, home to about 90,000 people. Pretty blue-collar town, home to a couple of academic institutions as well that have a growing presence. A lot of industrial agriculture still happening, but yet growing considerably with each year. I'm here to talk to you today about something that you've probably never heard of, and it's called a Healthy Conditions Assessment. And I'll explain all about this project and how it's conducted and what the results have been. The birth of it really was the Blue Cross Foundation asking me for help, and that this city, Nampa, was a recipient of a High Five grant, it's called, and it was received funds for 3 years to really try to intervene and do things on the behalf of youth obesity. They asked me to leave something for the city, a document. What could it be? What would they want? And so initially we talked about a health impact assessment, but ultimately we kept talking about it and realizing that it was going to be something different and something very unique, and frankly something that I've not seen done before, and I'm really thrilled to have been a big part of that. And that's what this whole program is about. This is an image that, while some may have a little reaction to it, is my personal sort of belief in a lot of ways. Having been on the City of Boise's Planning and Zoning Commission and a practicing planner for over a decade, Unfortunately, I've seen a good number of comprehensive plans that have a lot of contradictory language, talk about the notion of quality of life, public health, safety, everything, all of those things, but really and rarely do they get specific enough, and again, oftentimes are riddled with conflictive language. So it was really an idea of borrowing from the comprehensive planning process, but not replicating it in the sense that it sometimes can take a very generic approach, instead doing a much more deeper dive. That's where this process starts to come together. We used the following steps. Ultimately, it was about starting off with data, looking at information on a census tract level, which I'll get into momentarily, then refining our areas down to some hotspots so that we really know what's happening and where our problem areas are within our city and why. To then go out, confirm it by doing field investigation, then talking to people who know those neighborhoods much better than we could ever hope by finding out their opinions and thoughts and expertise, and then ultimately bringing everybody back in the room and trying to determine very good, solid, and pinpoint type of recommendations, things that are not just from the city either, that are holistic, from the private sector, from institutions, you know, you name it, nonprofits and on, recognizing it takes all of us to make success a go. So you're not going to be able to read all this data. I just wanted to show it just so that it's sort of illustrative purposes. On the far left, you see our census tracts. Why did we use the tract data? Well, the tract data helps us get more of a refined geography. You've often heard us talk about, especially within the health sector, that is our zip code that can kind of determine how healthy we are. And I do believe that that's true. However, in some cases, and for example, with the city of Nampa, they actually only have about 3 zip codes. Well, they have 16 census tracts. So we have a lot more information at our fingertips that we can use and layer it, rate it by quartile to kind of cross-compare and ultimately determine which of those tracts are flagging, and more specifically, why. And the next point is critical. As you can see in this particular graphic, we have 2 census tracts, 201 and 202. With our weighted average, we see that in one case, 78%, the other 74% of all categories that represent the social determinants of health, everything from income to job access to park access and beyond, are flagging at nearly 3 out of 4. But look at the differences from one neighborhood to the next. They're flagging for very different reasons. One, in the age of 65 and over, for example, is almost a 2.5-fold increase in number of car percentage and access to cars, which is important in this area because unfortunately we don't have a robust transit authority in that particular town, but it is important, so we had to include that. We're looking at, again, more than double in one of the other. Hispanic population, that is critical, and you're going to see why we included that momentarily. But you see in one particular tract, 10%, the other one, nearly 50% is at the Hispanic origin. That is important because when we look at the actual map, you can see that those 2 neighborhoods are right next to each other and split by 1 arterial. But from a demographic perspective, from social determinants of health perspective, they are very different. So this begs the question, and it illustrates why we did this approach. Why in the world would we go out and try to come up with recommendations for intervening and improving things that are generic, that are citywide, rather than specific, targeted, and precise within the given geography and our demographics? That's what this is really about. Knowing what the data is telling us, going in, doing the field work and interviews, and ultimately getting deeper with regard to what's occurring in these neighborhoods. The next step after the data was to then begin looking at the geography more precisely. So I went out, and also a colleague of mine went out and started to look at every single street, every intersection, inventoried, parks inventoried, civic uses, school sites, business, you name it, to try to understand a little bit more of what's going on. And we started to compile a list, and this is just an example of what that started to look like. So this is more of a micro hotspot, if you will, looking at some of these numbers. So for example, you see on the screen 2, 3, and 4, those are intersections that are very heavily traveled by pedestrians, but unfortunately had some issues. Number 11 is a 4 or 5 lane roadway that unfortunately is a bit of a barrier for right next to it, number 7, an elementary school. And so walking and bicycling rates, for example, to that school are very, very low, and on and on. So we really wanted to illustrate, again, just some of the things that are happening within our census tracts, at least within the transportation and a bit of the land use side, as you'll see. Our initial findings from the on-the-ground efforts and our data started off with some of these things. For example, crosswalk timing. Every single signal with crosswalk and signal for pedestrian timing failed to meet MUTCD requirements. In other words, they weren't given enough time. To the city's credit, they are already going out and improving all of those and retiming the pedestrian countdowns. So we aren't even done with the project, and the city's already going out and doing that and making things better for the walking environment. Other things, just the frequency of crosswalks is definitely not necessarily as frequent and promoting of walking as we would hope, as you'll see momentarily. And on and on. Bicycle facilities there should be ample opportunity for more bike facilities. The city's doing a pretty good job, but you certainly can accelerate the pace given some of the dimensions of our streets that are out there. Minimal green space. In some of our neighborhoods is the one that I just showed. For example, there is no park. That school is the park. That school is all things recreation. And so therefore, how do we improve that site beyond the academic aspect of what that school represents? And in some instances where we had older parks, there weren't exactly the options that really attracted that wide spectrum of users from an age group that we really hoped for. And again, I showed you one, the average age over 65 population was much higher. Well, again, using that as an informant, how can we improve, in this instance, parks? And then some of the other things that I'll get into momentarily. The next step that we use is one that we've used on a number of our health impact assessment projects and even other more general plans. And that's this model called the 7 dimensions of health and wellness. We did not create this. I did not create it, but I love it and use it all the time. It was created by the University of Wisconsin at Whitewater in the 70s and has been sort of massaged over the years to now have this 7 dimensions. How do we use it? Well, it's a recognition that our city has more things, more positive things in it than maybe what we realize, or that the things that we think of on a superficial level are deeper and have more impact than what we even realize. Recognizing that, for example, a food bank is not always just about physical health and access to food. It's about a social network. It's information sharing and on and on. Our libraries are absolutely not just about books. They are so much more than that, and I think all of us on the phone would probably agree with it. But it's illustrating to the folks who run the city and are part of it that we have many more assets than that we even realize. What we have to take advantage of and figure out is how do we improve access to those sites? How do we get people to use those places more, and how do we bolster their presence in the community if they're not already? The next piece is really about doing this, and that is, again, when it comes to leadership, we do that 7 dimensions of health and wellness exercise because it absolutely has a clear path right back to that comprehensive plan. And recognizing that a land use decision is not just about what's being built. It's about all of these other dimensions of health and wellness. These things are tied together, some of them stronger than others, but health is more than physical health. It's beyond just obesity and diabetes. And it's these different relationships that we clearly want to illustrate back to the community. The next phase of our project was to conduct a number of interviews. And these interviews, again, were not folks who necessarily spoke about conditions citywide. We wanted to get into those geographies. We wanted to get into the neighborhoods. We spoke to every single principal of all of the schools within those hotspots, for example. We spoke to church leaders. We spoke to, folks like Salvation Army who do a number of different interventions for the city in terms of feeding people, and on and on and on. These are the people who have their fingers much closer to the pulse of a community than I or a good number of folks even within the city itself. So we want to get their honest, raw opinion, and that really is what this project is about, holding up a mirror to the city, and that's where credit needs to be given back to the city of Nampa for allowing that to happen, because it's not necessarily always an easy conversation, or does it always result in happy, hot, so to speak. The next piece is starting to piece all of this together. So our document, which is nearing completion, starts to look like this, where we again showcase each of these hotspots, give a description, talk a bit about the folks who live there, what are those assets, concerns, and then what are the health indicators that are flagging in that area, so that we know what some of these particular realms are that we may want to try to intervene with, whether it's the city, again, nonprofit, business communities, or what have you. That's why we do this. So some other reasons, again, I think I've touched on some of these, but we want to be specific. We certainly want to be tactical, and really, again, get into that geography much more specific than, unfortunately, a lot of times we get too generic when it comes to those comprehensive plans, and we often sort of spread peanut butter, if you will, from edge to edge of our city limits, and try to think that we're going to go out and do all these wonderful things. Well, that's great and well intended, but unfortunately, I've yet to meet a city that has all of the resources necessary to carry out all of the objectives and goals typically found in those plans. And that's okay. This is more of a just recognizing that, and let's get more specific, let's get precise, and get those resources that we do have unveiled and really working for us where they're needed most. Beyond the geography piece, we started to develop 4 themes. Now these things do sort of apply broadly. They do get bigger. The reason why is we kind of heard some of these things bubble up in conversations, in field assessments, in beyond just the 1 or 2 census tracts. These are the things that really kind of hit citywide. The first theme, the imbalance in the housing spectrum, and I'll get into all of these more in a moment. The lack of transportation options. Transportation is of tremendous importance for overall health. Food access. This lower right is the image of what was called a Paul's Market, which was a neighborhood level market that is no longer there. Hispanic equity. This was a tricky one. This was a tough one, and I'll get into in a minute, but this was probably one of the most eye-opening pieces of this whole project. Transportation. We certainly have challenges walking and biking, and then challenges with regard to transit access. The transit is, by the way, not provided by the city, but a regional entity. We have lots of space within our streets, but not always the bicycle facilities. We have, in some cases, disjointed and disconnected sidewalk systems, and I talked about even crossing the road. That doesn't mean that is universal. There certainly are parts of the city where it's very easy to walk and in some cases bike as well. But when we do a little bit of a deeper dive and we get out there and look at every street, we'll see things like this. Here are 2 streets, when you look at it from above, that have very little difference whatsoever. Both neighborhood level streets, residential. However, when you go out and you take a good hard look, you'll see this. You see the same street cross-section, basically front on housing, driveway, on-street parking. One is 20 miles an hour. The other, 35 miles an hour. And most of you in the planning world know that 35 miles an hour is a speed that is definitely hazardous. Even 20 can be hazardous, especially for kids. But you get into 35 miles an hour on that same context or same design, then it certainly promotes a speed that is just doesn't really work well within a residential setting, especially given the narrowness of that particular street. When we look at transit, and some of you who know this particular website, All Transit, you can see what the score says for itself, but certainly we had a problem in terms of just the number of routes, the frequency, the headways, and really where the routes actually get to, and that was repeated in a number of interviews. That being said, the city can also do a better job in some regards with regards to getting people to the bus stops. In this instance, you see the bus stop here, which is on a major or a principal arterial state highway, 5 lanes, probably 25 to 30,000 trips per day, and you see this is about a 2,000 foot stretch to the north and a 2,000 plus foot stretch to the south. no marked crossing here. There's no reason for people to access this bus stop from the other side, from the north side of this intersection. Anybody trying to get there is coming from the south, but yet without a marked and stopped controlled access point or signal, you can see that this is clearly a deterrent for utilization of this particular transit stop. So there's work to be done on all sides for sure. The imbalance of housing, this is definitely an issue. We keep hearing the term affordable. I've yet to hear anybody say, hey, we have a proposal for unaffordable housing. In other words, housing that's, only attainable by the 1 to 2% of people on the high end, but we always have a problem when it comes to the other side, it seems. But yet, let's look at reality. The median price of rent in Nampa, for example, is just under $1,000 for all properties on average. The number of properties continues, and in this case, you can see the inventory has shrunk. So that's part of what reasoning is for the cost to continue to go up. Yet you look at the actual purchasing of homes, the median price overall for a house has been from $150K in 2014 to now at about $220,000, almost 40% increase in just 3 years, roughly. But yet, when you look at the income of the average household in Nampa, you can see where this starts to break up. You see that a mortgage on that price would be about $1,300 a month, throw in utilities. If we use that 30% rule that we all strive to achieve, you would actually have to earn $55,000. That doesn't even really include taxes, right? But you can see the actual median income is closer to 40, and then almost 1 in 5 is below the poverty line. So you can see that this is clearly an issue, and we heard about the doubling and tripling up of residents in homes in order to make ends meet. The third piece, food access, this is another huge part of our project, and recognizing that our neighborhood stores don't always have what we need. The market that closed, that was a big deal. And then you look at something like this, for example, where there is no grocery store in this part of the neighborhood, and this is one of the hot spots. This neighborhood here is definitely on some of the more concerned side of things. This is, I think it's this one. This is a Gateway Crossing, I believe, which is an affordable housing complex. Well, where are people going to go and get food? This was just built. In our neck of the woods, Maverick looks like this. It's a gas station mini mart. It's about a 4,000 square foot market. And how do we get there? Well, we're going to have to cross this very busy intersection, and our interstate runs here to get to this point to get something to eat. And that's, at this point, what access we do have. So ensuring that they do have some good options, and then hopefully maybe at some point bringing additional resources in interior of that neighborhood would be something that could happen hopefully over time. The last piece, Hispanic equity. This was, again, one of the harder pills to swallow. It's not something that people are always comfortable talking about, but this is where we are. You can see that the Hispanic population right now, we're looking at almost 50% of the Hispanics in this community, which represents about 1 in 4 residents, is under the age of 19. Transportation-related deaths for Hispanic versus non, a much bigger clip. And then median income is almost $20,000 or 20% less for Hispanic populations than in non. And you can see in terms of our demographic profile what that is looking like. Well, this is the future of Nampa. This is the future of purchasing power of business owners, perhaps, the leadership and so forth. So what do we decide to do with that in this moment, right here, right now? Do we embrace it? Do we figure out how to address some of these things? How do we proceed? When we look at causes of death, for example, we can see some things that really are striking. The number 2 death for Hispanic is accidents, and I just showed you car crashes is a major contributor to that. It's still high for non-Hispanic, but not quite as high. What is the lesson learned? How can we intervene in that regard? This one, however, the number 5 cause of death for Hispanics is not even on the list for non-Hispanic, and that's prenatal. We saw that insurance access for non-Hispanics was exceptionally low. Visits to the hospital during the first trimester was definitely lower, and other factors that may contribute to why this is happening. When we presented this to the St. Luke's Hospital Group, for example, who's in one of the major hospital groups here, they really didn't know. and this is now changing the way that they do business and how they face the community, specifically within their children's hospital and their programming and their outreach and education is all starting to change because of the discovery within this project. A few other things, the cycle of homelessness, domestic abuse, I mean, on and on. We found so many different things that came about as part of this project that when someone gets into that cycle of homelessness, it's extremely difficult to get out. Our resources may not be appropriate to get people out. Same thing with domestic abuse. Someone gets beaten. Unfortunately, if they don't have insurance, they end up having to pay for the exam themselves in order to get the police involved to determine just the level of abuse and things like that. I can tell you personally that my heart broke on a daily basis as part of this project. It was also filled in some ways as well, but it was a tough project and still is. So the last few slides here, some other things is us versus them was a description of what's happening in the downtown area, just kind of with the old guard versus new guard of business and how things are proceeding there and how we want to approach business moving into the future. The language gap was a tremendous issue that continued to bubble to the top. This final one, no dedicated traffic enforcement division, I'm happy to report that has changed. The police department now is fulfilling all of their vacancies and is now reinstituting this traffic enforcement division to begin doing some of the very things like in this picture that I just about witnessed, this person getting nailed, and on and on. So there has been some definite positive changes. And the last couple things I wanted to illustrate, this has been a very negative finding, I recognize that. However, there have been a good number of very positive occurrences and things that we've unearthed and shared with the community because they need to be proud, and there is a pride there. The Boys and Girls Club is busting at the seams. They're doing fantastic things there. There are neighborhood gardens that are actually not just sort of novelties. They're feeding people. The food is going to shelters. The food is going to churches. They're training Girl Scout troops, for example. They're coming in there and learning what it feels like to be part of that particular thing in gardening and getting your hands dirty. A veterans therapeutic garden, that actually is going to go into other parts of the city as a way to battle PTSD. There's summer feeding programs going on. And a whole host of things. There's a new clinic that was just built that is really allowing more and more folks to get health care that maybe didn't have it before. Infrastructure that the city is putting in and investing in themselves continues to happen. And just a good number of other things. So ultimately this project is this, if I can leave you with sort of a couple of things. We take and utilize the strength of the comprehensive plan with regard to the elements, because we know that's a good way to start and look at our city. We add in a dose of the steps of health impact assessment, and ultimately we do one other thing. We add the abnormal brain. I love using my particular abnormal brain because I think it's important that we think differently and we not just use our same old approaches. And ultimately, though, at the end of the day, when you put these things together, it's the recipe what makes this healthy conditions assessment go. So with that, I would certainly be thrilled. Anybody, you want to reach out to me, by all means, there's my number, email. Reach out to me. Let's talk. But otherwise, I will stand for questions. And again, just want to thank Elizabeth and the APA for this opportunity.
Great. Thank you so much, Chris. That was a fabulous presentation and interesting project that really reflects many of the themes that we've been hearing from our Plan for Health coalitions and our members working at the intersection of planning and public health across the country. So thank you. Thank you for that. So if folks have any questions, feel free to chat them into the question box that should be in the panel on the right-hand side of your screen. And while everyone is digesting the presentation and thinking about what they'd like to ask you, Chris, I wondered if you could share a bit more about the relationship between the Blue Cross Blue Shield Foundation and any of the local hospitals. I know that some of our Plan for Health coalitions have been very aware of community health needs assessments that hospitals often conduct, and perhaps there's some potential there to share information or to combine forces around the comp plan process and hospital assessment.
Sure. So the Blue Cross Foundation has a very strong relationship with both our two regional health or hospital groups, St. Luke's and St. Alphonsus. Both have particular staff members that have been involved in this process. Specifically, or more precisely, St. Luke's has definitely been very majorly involved every step of the way and has been great. And I want to make sure, just to be clear, that this is definitely not the CHNA type of an approach. It's a very different beast. This particular HCA approach has actually already begun in its neighbor of Caldwell. Once word got out of how it's gone, the city of Caldwell was very interested. Another population of about 60,000, and I think St. Luke's is very interested in us possibly doing this work in a couple of other major cities throughout the state. So the relationship with Blue Cross Foundation and the hospitals is a very, very strong one. They work sort of hand in glove on a number of initiatives, and I'm very happy to be working side by side with all of them. They're really great people.
That's fabulous, and I have to say your asset-based approach and your thoughtfulness in terms of engaging local stakeholders and hospitals as well as smaller nonprofits is really wonderful, and again, a theme that I think that we've seen in Plan for Health, and certainly a theme that Kayleen lived when she was working on the Trenton Health and Food System element to their master plan. I definitely saw some parallels between your work, Kayleen, and Chris's presentation today. We have a few questions coming in. One question is actually around the Blue Zones project, and if folks on the line are familiar with the Blue Zones work, and if you have any thoughts about the Blue Zones approach to health assessments for communities. And I will be honest, I am somewhat familiar with Blue Zones. Again, I've learned more about them through the Plan for Health work. The Lynn County Plan for Health project certainly leveraged the Blue Zones activities in Cedar Rapids, Iowa. And I know that our team in Oregon also connected with Blue Zone success stories. But are you familiar at all, Chris, Kayleen, or Pam? Have you worked with Blue Zones partners?
I have not. I do know of some of the folks that are there with the organization. In fact, I understand that they are going to be coming to our neck of the woods here in a couple of weeks as part of a separate project. But I don't know a lot of their work. Unfortunately, I've known Dan Burden. I mean, she's obviously someone that I think a lot of people have known for quite some time. But I'm not really familiar with what they've done.
Same for me as well. I'm not very familiar with Blue Zones as well, but I'm interested.
This is Pam, and we know a little bit about it. We actually looked into getting a webinar put together on Blue Zones and some of the work that they were doing in one of our states. But what I was really looking for before we could do the webinar was more of a demonstration, and I think they were at the beginning stages of it. So perhaps I should revisit that and find out if they're ready yet for that webinar.
Great. Okay, so more to come regarding the Blue Zones work, and thank you for that question, Ashley. We do have a couple of folks wondering really about the equity angle that you shared, Chris, and certainly it can be challenging and is challenging for communities to talk openly about the social determinants of health and the impacts of the inequality that folks are facing in their own community. And I wondered if you could speak a little bit about the language barrier itself. This particular question is how did you overcome language issues when you were conducting interviews, and how did you try to facilitate cross-cultural conversations?
Yeah, great question. And so a couple of clarifications is that recognizing that certainly in a lot of various types of plans, corridor, intersections, even comp plans, there is an ability to go out to the general public and conduct different types of events. We didn't necessarily have that ability as much. However, we did work with people who are very much engaged in a number of different types and areas within the community, especially the Hispanic populations. So what we did is we identified, in this case, I think I interviewed, I want to say, a half dozen folks who work within the Hispanic population daily, in a number of capacities. And those are the folks that we really spoke to. So in terms of the knowledge, it was fantastic to hear their opinions, because as you'd imagine, they were ready to give them. And believe it or not, this discussion, I think, was as difficult as it was to swallow. It was received very well, especially by the folks within the community with obviously a Hispanic background, and echoing some of the things that they've been realizing and living with for years has been something as a bit of a fresh air. And we're excited because I know that a lot of people are finally kind of going, okay, yep, this is that moment for us, and we need to make some changes. So the equity piece was definitely there from the get-go, and it isn't even just about the Hispanic culture of the equity component, though. We talked a lot about the disabled population. There's a lot of folks in the downtown area that have a higher population of disabilities than in others. And ADA compliance, for example, and accessible parks and the different things that way, transportation, getting to and from places just to get things to eat was another sort of element of equity in a way. So it was a significant theme throughout this project, and one I'm very, very happy, I think, with how we address.
This is Kayleen. I wanted to add the working groups all focus on equity as well. They are very concerned about cultural competency and then health equity in all policies and in the way we partner with different groups, thinking about how do we increase access to health care? Is it a siting issue? Is it a different transportation safety needs? But really just starting to think about the communities that we're going to and understanding what works for them. And so that has to do with race, it has to do with disabilities, it has to do with language, religion, and so on, and just really trying to be confident about what works for them.
Thank you, Kayleen and Chris, for sharing more about that. And perhaps on a related note, there is a question about sustaining partnerships, and so certainly it sounds like you've had some fabulous conversations, Chris, and we hear this from our Plan for Health projects across the country, really connecting with folks and bringing new voices to the table. And then how are those relationships moving forward beyond a given funded period? And is there a coalition in place to carry forward the action plan around your work, Chris?
Yeah, another good question, and absolutely, that is a huge piece. And so that was, from my experience, borrowing from the world of HIA. And those of you who know HIA know that one of the steps moving forward is monitoring. And that is a major component of our plan as well, and giving specific action steps to the various groups that are involved. I will say that when we had our stakeholder workshop, which was about a month ago, we had in that room, I think, 110, 120 people that represented a number of entities, private, public, you name it. And I was just thrilled at the reception that the folks had with regard to even just introducing themselves to each other, because a lot of folks hadn't been in those same rooms, and they maybe only caught wind of this or caught wind of that. And so many people at the end of that were very complimentary, which was very humbling, of that component of it, of meeting people that they didn't know. We purposely put them at tables with people that they didn't always know. And so I'm confident that a lot of those relationships were sparked as part of this discussion. And as moving forward, the best that I can hope for is with that monitoring step and the leadership of the city and the mayor. I got to give credit to the mayor. He has taken this and really run with it. In fact, his State of the City address was about 2 weeks ago, and about 25% of his hour was spent on this project. And so that was his leadership, and the rest of the city, I do have confidence, are going to be moving forward with this in the future.
Great. And Kayleen, would you like to speak to the Trenton Plan for Health project in the sense that the Plan for Health leadership team did connect with an established coalition, and of course the adoption of the health and food system element in the master plan is almost a sustainability strategy in itself, but you all are very thoughtful in leveraging the Trenton Health team, a group of folks who were on the ground already who could potentially continue and carry out that work.
Yeah, for sure. So as a part of the Trenton Healthy Communities Initiative, we were developing the first health and wellness element in the state of New Jersey. And what was key here was not to reinvent the wheel, because there are a lot of different organizations working on health and wellness in various cities, especially in Trenton. And in Trenton, there was the Trenton Health Team, and they already had an advisory group going and meeting to come up with the health needs assessment and then to come up with different strategies to address that. So that brought together a bunch of nonprofits and healthcare organizations and city government departments, all the key stakeholders we needed to access for the health and wellness element in Trenton. And as a part of this, really what we were doing was documenting what was already going on and bringing it to one key spot in the city, the comprehensive master plan element, so that it could help guide land use and zoning strategies for the next decade. And it could help these different community organizations and healthcare organizations in the work that they're already doing, and there could be city support. And I think that was really important because, we weren't trying to create additional work for anyone, especially in a city that has so many financial issues in terms of like where dollars can be spent. But we wanted to leverage what's already going on and make the connection. And I think we were pretty successful in that, and I'm excited to see where it goes.
Great, thank you, Kayleen. And I'm realizing we are actually out of our time. It is just 1 minute after the hour, so I will officially close the webinar. But if you would like to stay on the line, Chris and Kayleen and Pam are available for another couple of moments if you have a last-minute question you'd like to get in. I did want to let folks know that we do have a couple of webinars coming up in April. So next Wednesday, April 5th, we will have a Food Action Plan webinar at 3 p.m. Eastern Standard. And then on April 12th, we will have our next installment of the Planners for Health series. And the topic for that webinar is health equity, which certainly, of course, came up today and is something that we all are thinking about. So for more information about the upcoming events and or just the Plan for Health Coalition, please feel free to check out our website at plan4health.us. And I just want to thank you, Pam and Chris and Kayleen, for being on the line this afternoon. This was a fabulous presentation and discussion, and we really appreciate your time.
Great to be here.
Yeah, thank you.
Yes, thank you.
I will officially close the webinar. Feel free to contact me with any questions and look for the follow-up email with the recording and additional resources. Thank you so much.